Very good morning, students. Again, in the last video I have told you about the bony features of the ilium. Okay, now we will learn about the muscular attachment and ligamentous attachment of the bone called as ilium. Okay, so we are an ilium, and first we will learn the attachment of the muscle. Let us come to the upper end of the ilium. As I told you that this expanded structure is the upper end of the ilium, which is called as the iliac crest. So first we will learn about the attachment onto this upper end iliac crest, which is divided into the ventral two-third, which is slightly convex outward and concave inside. If you see it from upper surface, so try to see in your bone the upper border, okay, from above, okay, and this is the dorsal one-third, which is concave outward and convex inside. Okay, so this is an S-shaped or curved iliac crest or the upper end. I will tell you about the attachment of this iliac crest first into the its ventral two-third. Okay, ventral two-third, which has an inner lip, an outer lip, and an intermediate area, okay, and an intermediate area. Let us begin with the anterior superior iliac spine here. And here in the anterior superior iliac spine, okay, there is the attachment of the lateral end of the inguinal ligament, as you must have already learned. So this is the lateral end of the inguinal ligament, which is attached to the anterior superior iliac spine. Then there is a muscle attached, which is attached onto the outermost lip of this, or the outer lip of the iliac crest, okay, in its anterior part only. Okay, this is called as tensor fascia lata. Okay, you can see this pink color, tensor fascia lata. And then just medial to it, okay, in the anterior two-third of the ventral part, okay, this is the ventral part or ventral segment of it. In its anterior two-third part, on the outer lip itself, there is the insertion of the muscle called as external oblique abdominis. So just remember that this is the insertion which is medial to the origin of the tensor fascia lata, which will go into the thigh. Then in the intermediate area, there is an insertion. It is the origin of the muscle, okay, which is extending throughout the extent of the anterior two-third part of the this ventral segment of the iliac crest, and this is the origin of the muscle, which is called as the internal oblique abdominis. Internal oblique abdominis, close to the inner lip, okay, or onto the inner lip of this. Again, there is an origin of the third muscle of the anterior abdominal wall, which you must have learned is called as the transversus abdominis. So again I will revise. Outermost lip giving to tensor fascia lata, external oblique abdominis, insertion, and then there are two origin, internal oblique abdominis and the transversus abdominis, from outer to the inner side. Now to the innermost aspect, the posteriormost part of the anterior two-third, okay, it is the posteriormost part of the anterior two-third of the ventral segment. There are two muscles, they are also seen to be taking origin here. This part, okay, if you can see properly, yes, this part, which is just at the junction of the ventral two-third and the dorsal one-third, this is the origin of the latissimus dorsi, a small origin from the outer lip, okay, it is latissimus dorsi. And then from this, similarly at the same level from the inner aspect, okay, see, this is iliac fossa. From inner aspect, there is the origin of a muscle called as quadratus lumborum. So it is the latissimus dorsi and the quadratus lumbum. Now we come to the posterior one-third segment of the upper end or the iliac crest. See this in my between thumb and finger, this is the posterior one-third part, and it was the ridge and this was the sloping surface, outer sloping and the inner sloping surface. The outer sloping surface, okay, will give attachment to the muscle called as the gluteus maximus. This, okay, gluteus maximus. And the inner sloping surface will also give origin to a strong muscle here, okay, say inside the sloping surface called as the erector spinae, which is the muscle of the back. So gluteus maximus on the outer sloping surface and this erector spinae on the inner sloping surface. And to this ridge will be attachment of a strong ligament called as the thoracodorsal ligament or thoracolumbar fascia. Thoracolumbar fascia will get attachment to this ridge between these two muscles, okay, about which we will learn when I will teach you about the lumbar vertebrae, okay, lumbar vertebrae. So these were the upper attachment of the iliac crest, okay, these were attachment. Now I will tell you about the attachment first, about the gluteal surface or the outer surface, where the various, area is divided into four, which I have told you that it is divided into the posterior gluteal line. Okay, let me draw it with the white chalk. Okay, posterior gluteal line. See this chalk lining here? Posterior gluteal line. Then there is from the upper border of this greater sciatic notch going forwards, inclining downwards, okay, to the tubercle here, the ilium, right here 5 centimeter behind this anterior superior like spine. This is the anterior gluteal line, and then from apex right up to the superior to that of the anterior inferior. So this is the origin of the reflected head of the rectus femoris, and this was the origin of the straight head of the rectus femoris muscle, which are the muscle, as I said, for that of the lower limb. Now let us go to the sacropelvic and the iliac fossa. The iliac fossa, which is a large, smooth and shallow area, this gives attachment to the origin to a muscle called as the iliacus. Okay, so this whole area of the fossa, except in its lowermost part, the whole area gives attachment to that of the iliacus muscle. Okay, so this is the iliac fossa attachment. Now just if I go to the anterior border here, which is anterior superior iliac spine, giving attachment of the lateral end of the inguinal ligament, just below that there is the origin of a muscle called as sartorius. This muscle origin is here from the anterior border, sartorius, and we have already learned that this is the attachment on the anterior inferior iliac spine of the straight head of the rectus femoris. Okay, let us see the attachment onto the pelvic surface of the sacropelvic surface. Okay, now here is the attachment of muscle which is quite extensive and taking origin from the ischium, okay, right up to the obturator foramina and surrounding to it. This is the obturator internus origin. So on the pelvic surface, just below this arcuate line, okay, this was the arcuate line, and just below arcuate line, this is the attachment of the muscle called as the obturator internus muscle. Now other attachment, ligamentous attachment, which are here, this is the iliac tuberosity, okay, above the auricular surface, that is on the topmost portion, 1/3 of the sacropelvic surface, and this area gives attachment to the intraosseous sacroiliac ligament. Intraosseous, very strong, strongest of the body. This is the strong sacro, which binds the sacrum with the ilium, okay, and this is the auricular area which will give attachment to the auricular surface of the sacrum to form the sacroiliac joint. So this is the articular surface of the sacroiliac joint is there. Sometime if the female, the hip bone is from the female and who has given birth to many children, then there will be a groove will be seen here, okay, and this groove will be for the another attachment of the ligament of the sacroiliac joint, okay. This is the ligament of the sacroiliac joint, okay. Now I think this completes all the attachments of the iliac bone on its outer surface, that is gluteal surface, in its iliac fossa, and then in the sacropelvic surface, and onto the upper end, that is the iliac crest in its ventral 2/3 and in its dorsal 1/3. Okay. Thank you very much for watching this.